Okay, good afternoon. So today we are going to discuss what is called ectopic pregnancy. So we are going to base our discussion today on what is called ectopic pregnancy. So what is ectopic pregnancy? So ectopic pregnancy, this is a type of pregnancy that grows outside the uterine cavity or outside the endometrial wall of the uterus. That's what we call ectopic pregnancy. Ecto means outside, so meaning anything outside its actual place. Okay, so in this case, anything or any pregnancy that grows outside the uterine wall is called ectopic pregnancy. So this pregnancy can either grow from the abdominal wall, it can be from the ovaries, it can be cervical, it can be on the fallopian tube. Okay, so that's how we define ectopic pregnancy. So let's look at what are some of the common sites. What are the common sites for why this ectopic pregnancy grows from? So one being the fallopian tube, which is the commonest fallopian tube. So in the fallopian tube, there are a lot of sites. Okay, there's the ampulla, there's interstitial, accessory ostia, okay, on the fimbriae. So those are the most common sites where this ectopic pregnancy can grow from in the fallopian tube. To be precise, in the fallopian tube, the most common one, which carries about 90%, is on the ampulla, because on the ampulla, that's where fertilization takes place. So we understand now that there it's common, it can be easy for this pregnancy to grow from, because that's where fertilization takes place. Okay, the other sites we have the abdominal wall, the cervical region, the ovaries, and all that. So those are some of the commonest sites for ectopic pregnancy. Okay, so now let's look at what are some of the causes for ectopic pregnancy. What are some of the causes for ectopic pregnancy? So some of the causes for ectopic pregnancy, ectopic pregnancy, the causes are classified into two. We have congenital and acquired. Congenital meaning it's something that it's genetic, it's there. Okay, and then acquired, it's something that you can acquire. Okay, it's something that you can acquire. Okay, so under congenital causes of ectopic pregnancy, we have the first thing being tuberosity. Okay, that's the first cause. The second thing is what you call tubal hypoplasia. That's the first one. Okay, and then we have what we call tubal diverticuli, meaning there'll be formation of there'll be pouching on the fallopian tube. There'll be pouch that will be formed, such that if that fertilized egg has been formed, it will be trapped by that. So meaning to go in there, it will be that pouch that will be formed, and then that will engage itself in that pouch. Okay, and then we have what we call partial stenosis. That's the other congenital cause for ectopic pregnancy under congenital causes. So moving now to what we call acquired causes. So acquired causes for ectopic pregnancy, the first one being previous history of ectopic pregnancy. So any woman that had ectopic pregnancy before, she's at risk of having a recurrent ectopic pregnancy. She's at risk of having a recurrent ectopic pregnancy. Second thing is what we call PID. So any woman who is having a PID, so this woman, she's at risk. Chronic PID can lead or predispose a woman into having what is called ectopic pregnancy. Reason being because that PID might disturb the cilia, okay, might disturb or distract the cilia in the fallopian tube. That helps to propel the fertilized egg direct into the uterine cavity. So if this cilia has been disturbed, meaning there'll be nothing that will propel this fertilized egg or ovum to go to the uterus. Okay, so that's about PID. The other one, we have what we call diverticuli. As I said, we are going to have formation of that the outpouching. Okay, there'll be that outpouching thing that will be formed where this fertilized egg might be trapped. Okay, that fertilized egg might be trapped. The other thing is what we call adjacent tumors. Okay, adjacent tumors on the fallopian tube. So some tumors also might predispose a woman into having ectopic pregnancy. Okay, last and not the least, the other risk factor for that, previous surgery. Okay, previous tubal surgery such as recanalization of the tubes. So that might predispose a woman into having ectopic pregnancy. Okay, so of course, ectopic pregnancy is classified into two. We have ruptured and unruptured ectopic pregnancy. Ruptured meaning it has ruptured. Okay, if it's from the fallopian tube, meaning there it has ruptured, meaning there will be that bleeding that will start taking place. Okay, if it's in the cervical region, there will be rupturing and everything. So that's it. We have ruptured, and then unruptured, there'll be symptoms of ectopic pregnancy, meaning but it hasn't ruptured. Okay, so that's it about ruptured and unruptured ectopic pregnancy. Now we move on now to clinical features. So what are some of the clinical features that will give you a hint that this might be an ectopic pregnancy? So the ectopic pregnancy, it has a triad, meaning there are three major symptoms or clinical symptoms that you need to look out for you to suggest or think that this might be an ectopic pregnancy. The first one being amenorrhea. So amenorrhea, of which you know every woman when she's pregnant, there's amenorrhea, of course. Okay, she's not having menses, mostly 6 to 10 weeks. Okay, other books will tell you 8 weeks. Okay, within that same duration, 6 to 10 weeks of gestation age, she needs to have amenorrhea for that long. And then the other one, she's going to have low abdominal pain. The reason why she's having that low abdominal pain, for example, if it's in the tubes, because um, there's that fetus that has embedded itself in the fallopian tube. So the fallopian tube now, since that fetus is growing, it will start stretching. Hence, see this woman having what is called abdominal pain. Okay. The other thing will be vaginal bleeding. So this woman will start bleeding. Okay, this woman will start bleeding. Okay, so those are the three major symptoms for ectopic pregnancy. Because if there's that ruptured ectopic pregnancy, because of that internal bleeding that is taking place there, so this woman might undergo shock. She might even go into shock. Okay, so the other symptom, which is not part of the triad, this woman might have what we call a Danforth sign or Coren sign. So what is this Coren sign? This Coren sign, this is a situation where this woman will have a shoulder pain. Okay, so this shoulder pain initially comes about. Let's say there's this ruptured ectopic pregnancy, meaning it has ruptured. So now there'll be that blood that will start leaking. Okay, so that blood will start leaking down inside, and then now it will start irritating the diaphragm. So there'll be that diaphragmatic irritation. Okay, so because of that diaphragmatic irritation, remember there's a nerve called phrenic nerve that connects from the diaphragm to the shoulder, to the tip of the shoulder. So due to that irritation of this nerve, this woman will be experiencing that shoulder pain. Yeah, and then other symptoms, of course, might present with symptoms like vomiting and all those. But those I've mentioned, those are the major classical symptoms for ectopic pregnancy. Okay, so now we're going to look at what are some of the investigations. What are some of the investigations that you can do in someone that was suspecting of ectopic pregnancy? Okay, so of course, when this woman comes, okay, when she comes, she's in pain. She has presented with all those symptoms that I've mentioned. She might present with some, not with. She might present with some of the symptoms, but not all. So for first investigation that you can do, of course, you can do what we call cardosynthesis. Okay, so cardosynthesis meaning you're going there with a needle, okay, or 10 cc. So you're going there in the pouch of Douglas. You're trying to aspirate, okay, the fluid. So you're going to discover that as you're aspirating there, you're going to start aspirating blood, especially in these women that have got ruptured ectopic pregnancy. You're going to aspirate a non-free flow, a non-clotting free flow blood. Okay,